Hi, my name is Leah Lynch and I am a registered nurse case manager. Today we are discussing implementing an evidence-based care plan in response to the Villa Health telephonic nurse triage case study to better train and prepare nurses to use this alternative care approach, how best to take advantage of their nursing skills, including active listening and motivational interviewing, how to translate their direct patient care skills to a telephonic style of patient care. The Villa Health case study identified that this transition from direct patient care to learning a telephonic care approach was the hardest challenge experienced by triage nurses, with other challenges including handling difficult patient call scenarios, learning new technology, and working remotely. How can we best support nurses to be successful in transitioning to a telephonic nursing triage role? An evidence-based plan has been developed using the Paris framework to evaluate and research the patients using the triage line, to assess the remote work environment, and how to put into practice resources to provide effective care and create nurse-patient value. To begin with, when training to the telephonic triage nurse role, nurses will train to the assessments used by the Villa Health team for patient interviews. They will learn how each question may elicit different responses from a patient, learn how to use nursing judgment to ask follow-up questions, and how to interpret the tone and cadence in which a patient responds to those questions. Specific scripting will be provided for potential diagnosis-related triage calls. Triage nurses will role play with each other and practice call assessments, building relationships with each other to enhance job satisfaction in this remote role. They will also take continuing education courses in developing telephonic assessment skills. Ting et al. 2017 found that developing algorithms for the top diagnoses that the organization receives triage calls for will help create process flows to best assess healthcare conditions. Within the technology provided, diagnosis-specific assessments and workflows will be available to access dependent on the needs of the patient, and they will provide the nurse specific assessments and workflows to ask questions to best understand where the patient's knowledge barriers and gaps in care are, to provide evidence-based education and guidance. By implementing role-specific training for nurses and allowing role-play practice, they will be better prepared to take calls and care for the telephonic patient. By providing diagnosis-specific tools to guide the triage nurse through the call, they will feel better supported, knowledgeable, and be able to focus on patient-centered needs. Ongoing education will help to assess if the initial training was helpful to build confidence and reinforce learning through practice and real-world experiences. To better assist the Villa Healthcare team to create a more robust evidence-based care plan, additional information about what types of patient calls are received, the types of challenging calls encountered, and the setting for which the nurses are working on behalf in their remote location would be beneficial to developing a care plan. The setting in which a nurse works, are they working for a health plan? Are they working on behalf of a primary care office or a specialist's office, or perhaps on behalf of the hospital emergency department? Knowing their triage role would better guide the diagnosis-related tools and better support patient outcomes. If we know what type of technology the nurses are provided for this role, we could better focus training and team meetings to promote an understanding of how to use the tools and provide a greater sense of team. Christian Berry 2017 references the Paris Framework evidence-based practice model focused on evidence, context, and facilitation. We use this to identify research that would be relevant to the telephonic clinician experience and patients that might be encountered. It helped to focus on the components of a call that need be considered to quickly establish trust and rapport, to use technical skills to elicit information from the patient that cannot be seen, and provide education that that patient can use to improve their quality of life. The evidence was used to create a contextual education program that would begin with the initial training phase, discussing specifics of how to be successful in virtual skilled assessments, offer subsequent educational opportunities to reinforce learning, and support the team. The journal article written by Ting et al. 2017 identifies by providing diagnosis-specific algorithm tools, they are facilitating enhanced assessments, educational skills, and supporting their technological needs to improve nurse success and improve patient outcomes. How is value captured here? Subjectively, the nurse job role satisfaction can be captured through a personal sense of feeling prepared to make a difference for patients by navigating challenging calls. And we can also offer employee surveys. Subjective patient value and satisfaction in the call triage process can be captured by phone surveys and or by mailed surveys. Rodriguez and Perlot 2017 identify that an organization can objectively assess value of an implemented care plan through claims data, hospital admissions and readmission rates, and cost savings to the healthcare system by reducing unnecessary healthcare utilization. These elements together would show the value of implementing a new, strong educational program to support improved patient assessment and education techniques. When building this care plan, the Paris Framework evidence-based model, detailed by Christian Berry 2021, was the most useful resource to establish a clear way to focus on what the problem was, to locate credible research that would promote nurse confidence when transitioning from direct patient care to telephonic care, and it helped to identify the struggles that remote telephone workers may encounter, how to bridge those gaps and create team-building opportunities. It finally focused on implementing a nurse and patient-based approach to improve outcomes. Ting et al. 2017 provided the most relevant evidence for building diagnosis-specific algorithms and workflows to streamline assessments, focus on reported symptoms, and bring stability to many of the most common causes for hospital readmissions. This helps the nurse better assess the symptoms a patient may be experiencing and be more effective in their communication with the patient to offer health education and recommendations. Rodriguez and Perlot 2017 focused on the perceived value of the interventions provided. Of the three resources, this was the least effective in building a care plan, but will be the most effective later when evaluating if this plan was successful. The Villa Health System has access to video conferencing, which is rarely used, but might enhance team building and create a positive workplace culture. The nursing team has already the beginnings of a strategy to better improve interdisciplinary collaboration through creating an instant message board all nurses can use throughout the day. Having other clinicians available to tap into for knowledge and support while speaking with patients, while navigating difficult situations, and facing diagnoses they are unfamiliar with is a significant benefit and will promote overall job satisfaction. In the future, having virtual clinical rounds in which team members may share details of patient calls without sharing PHI or personal health information, and to discuss how they managed that individual call, the skills and assessment techniques used during that call, and to offer opportunity for their colleagues to provide feedback or ask questions would help to facilitate a stronger learning environment and strategy for interdisciplinary collaboration, and to have more open discussion about recommendations for future calls so that both the nurse presenting and their colleagues taking part in the clinical round can build relationships together, but also build key skills to enhance their nursing practice. Villa Health managers could consider hosting other types of team meetings or project groups in which team members can gather and collaborate to utilize their knowledge enhance their current resources, and develop ongoing skills practice. It is the hope by implementing role-specific training with assessment rationale, role-playing, and diagnosis-specific workflows that the triage nurses in this remote environment will feel more confident stepping into the telephonic nurse triage role and increase their job satisfaction through building relationships with their fellow nurses and finding success through their patient calls and care. Thank you for your time today. I do hope this evidence-based care plan will be effective and look forward to hearing results.